Hello, my friends. Welcome to another episode in the series on consulting case interview prep. This is a follow up to the previous video where we learn how we will approach profitability cases. And as I mentioned in the end, towards the end of that video, that I'll create a video that puts the approach that we learn in practice. And so this is the follow up video where we'll apply what we learned to a real McKinsey case. This is an old McKinsey case called Magna Health. Now, the way you should run this is I'm going to read out the prompt, and then you should take some time to write your clarifying question, write down your clarifying questions. I'll run through some clarifying questions, and then you should basically pause this video, take a couple of minutes, time yourself, and then unpause the video and join me and compare your approach with what I'll share here. Okay? So, with that said, let's dive into the prompt for this interesting case called Magna Health. So your client today is Magna Health. It's a healthcare company in the Midwest in the US. It both insures patients and provides healthcare services. Employers pay a fixed premium to Magna for each of their employees, in return for which Magna covers all necessary health services of the employee. These services range from physician care, medication to hospitalization. Magna currently has 300,000 patients enrolled in its plan. It has 300 salaried physician employees who provide a broad range of services to patients in 6 centers. These physicians represent a wide range of specialty areas, but not all areas. When a patient needs medical treatment in a specialty area not covered by a Magna physician, they are referred outside of the Magna network for care. And in these instances, Magna pays all referral costs on a fee for service basis. Magna does not own any hospitals itself, instead, contracting services from several local hospitals. Over the past 6 months, Magna has been experiencing declining profitability. Magna CEO has retained McKinsey to help determine what is causing the problem and how Magna might fix it. So, how can Magna Health improve its financial situation? So, that's the prompt. It's also in front of you, so you can take a look. Now, take a minute, just write down a few clarifying questions, and then we'll talk about the clarifying questions. Right? So, I think what was very interesting is they mentioned that they've seen this decline starting 6 months back, right? So has Magna done something differently over the last 6 months? Have they changed something? Maybe they changed the pricing, maybe they have changed the supplies of their hospitals, right? Maybe they have changed the physicians and the payroll has changed. Have they done anything that has changed over the last 6 months, right? Second question is business model related question. So it's always a good idea to clarify the business model of the client, right? So are there different types of plans or different which carry different premiums, right? So we just want to understand, is there just one plan with a fixed premium, or do they have different categories of plans? Are there any co-pays or deductibles, or in other words, are there other revenue streams other than the premiums that Magna collects? Now, one thing that I would definitely inquire is what is fee for service basis, right? I'm not from this industry, so I don't understand this term. So I would definitely clarify what does that mean. Right. And one other business model related question could be around like just double checking whether all services and staff other than the 300 physicians are contracted, right? So they just have those 300 physicians and maybe some kind of central management team, but other than that, everything is contracted. Now you might have certain other questions. That's totally fine. But the idea is just to clarify, get a little more clarity about what the problem is, how the client actually operates, before you proceed in creating your own structure. Okay. So now would be a good time for you to pause this video, take a couple of minutes, time yourself, and then join me as I discuss the solution to this case. All right. All right, so hopefully you utilize those 2 minutes wisely. So just recapping the approach that we learned in the previous video, We're going to have 3 buckets. Where is the problem coming from? Why is there a problem? And how do we fix the problem? Right. So where is, remember, it's just segmentation. So I'm going to segment my revenue premiums by plan type, employees, patient demographics, therapeutic areas, right? Of my patients. Just some ways to better understand, like, has there been a decline in certain kinds of segments, right, where the premium has been declining. And on the cost side, I think mostly operating expenses, the salaries that we paid the physicians, the contracts that we have for various medical services from the hospitals, any fee for service or referral services, and then any overheads that would be central offices or management salary, right? So I would want to see a historical trend for these costs, how they have changed over time, and see if there's a spike in any particular cost. That might explain the problem. Now moving on to the second bucket, remember here this is all about uncovering the root causes. So I'll first start by talking about the root causes on the revenue side, right? So over here, I'm not so interested on the external side, right? It's not like we are losing patients. It's not like we're really concerned about what the competition has done over here, right? It's not like the client has mentioned that there has been a steady decline, right? So it looks like the customer base is pretty fixed. So I would be more interested on the internal side of root causes. So always remember, right, you don't have to use everything that I covered in that approach. Please use your discretion and only choose and pick things that would be applicable to the client situation, right? So in this case, I'm just going to talk about, have there been any changes in our pricing for premiums? Has there been any shift in the mix of plans, if we do have mix of plans with patients or employees, right? The idea being maybe they move to cheaper plans. That's why we have less premium collected. And root causes on the cost side would be increase in the price of contracted services. Remember, anything that we are procuring externally, or doctor salaries, or inefficient use of resources, right? That was the second use cause. So maybe when we are contracting these services, there are penalties for using extra supplies because there's too much waste, right? Maybe we are doing unnecessary tests that are not needed, right? Maybe we are doing too many referrals. Our doctors are just referring way too much, right? So all this might be resulting in an increase in our overall cost structure. And finally, moving on, how do we fix the problem? Remember, we really don't know what initiatives would suit our client situation. But just to give a few ideas would be, we can increase our premiums. If we don't have deductibles and co-pays, we can start introducing those. We can launch new kinds of insurance products, maybe in therapeutic areas we don't currently cover, right? And we can maybe think about expanding our customers, engaging with new employers so that we have a bigger customer base. And cost-oriented initiatives could include things like renegotiating with the hospitals from which we are contracting these services. Try to see if we can cap the doctor fee or make it more performance-based, right? And maybe we can start introducing some standard operating procedures for our doctors to follow so we can minimize the tests, the referrals, when they are not necessary. Right? So this is how I would approach this problem. I hope this crystallizes, or at least makes it a little more clear, of how you would apply what we learned in the previous video to a real case, right? As always, comments are always welcome, and if you have any questions, please leave them in the comments, and I'll see you in the next video. Till then, take care and goodbye.